Automatic at 65? You might want to double-check that. Many people turning 65 assume Medicare just kicks in on its own, no paperwork, no planning, no worries, but the truth is, that only applies to some people. For others, missing your enrollment window can mean penalties that follow you for the rest of your life. In this video, we'll walk you through the structure of Medicare, the real deadlines that matter, and how to avoid common, and costly, mistakes. Whether you're planning for yourself or helping a parent or spouse, this guide will help you take control. Let's begin with the basics. What exactly is Medicare? Medicare is the federal health insurance program for people age 65 or older, and for some younger people with disabilities, but just because you're turning 65 doesn't mean the system automatically brings you in. Unless you've already started receiving Social Security benefits, Medicare enrollment is something you need to do on your own. And that's where most people make their first mistake. Medicare has two main parts, Part A and Part B. Part A covers hospital care, including inpatient stays, skilled nursing facilities, hospice, and some home health services. Most people don't pay a monthly premium for Part A, as long as they've worked and paid Medicare taxes for at least 10 years. Part B, on the other hand, covers doctor visits, outpatient care, preventive services, lab work, X-rays, and medical equipment. Unlike Part A, Part B always has a monthly premium, and that premium amount can change depending on your annual income. Now, here's the big catch. If you are already receiving Social Security by the time you turn 65, Medicare will enroll you automatically, but if you're not, if you've delayed Social Security, or aren't eligible yet, you must actively sign up. Let's repeat that. Medicare Part A and B do not start automatically unless you are already on Social Security. So if you're planning to delay your Social Security, which many people do for financial reasons, you'll need to make sure you register for Medicare on your own. If you miss the right time to enroll, you could pay a penalty that sticks with you forever. So, when is the right time? It's called your Initial Enrollment Period, or IEP. Your IEP is a 7-month window that begins 3 months before the month you turn 65, includes your birthday month, and continues for 3 months after. For example, if your birthday is in July, your enrollment window is April through October. If you enroll during the first 3 months, before your birthday, your coverage begins the month you turn 65. But if you wait until the last few months of that window, your coverage could be delayed by 1 or 2 months. And if you miss the entire 7-month IEP, that's when the trouble really starts. Let's take an example. John, a 65-year-old from Arizona, thought Medicare was automatic, that he wasn't collecting Social Security yet and didn't sign up during his initial enrollment period. By the time he realized his mistake, it was too late. That he had to wait for the general enrollment period, from January to March of the following year, but his coverage didn't begin until July. That left him with no insurance for several months, and worse, he was hit with a 10% penalty on his Part B premium for every 12 months he had delayed. That penalty, it's permanent. For the rest of John's life, he will pay more every month, all because of a misunderstanding. That's why timing matters. Now let's talk about the General Enrollment Period, or GEP. If you miss your IEP, you can only sign up for Medicare between January 1st and March 31st of each year, but even then, your coverage won't begin until July 1st, and if you delayed without having valid insurance coverage, you may also face those late enrollment penalties. And we're not just talking about small fees. The Part B late enrollment penalty is 10% of your premium for each full 12-month period that you could have signed up but didn't. So if you delayed for 2 full years, that's a 20% monthly penalty, for life. That's money out of your pocket, every month, for decades. Worse, if you need to see a doctor, undergo tests, or go to the hospital before your coverage starts, you're on your own for those bills. And in the US that can mean tens of thousands of dollars. But there is one big exception, the Special Enrollment Period, or SEP. If you or your spouse are still working past age 65 and have health insurance through an employer, you may qualify for a Special Enrollment Period. That means you can delay Medicare without penalty, but only under certain conditions. First, your employer must have 20 or more employees. Second, your health insurance must be considered creditable coverage, meaning it meets Medicare standards. And third, once your employment or insurance ends, you must enroll in Medicare within 8 months, or you'll face the same penalties as before. Many people assume that any health insurance will let them delay Medicare, but that's not true. Let's look at another example. Maria continued working until age 67 and kept her private health plan, but her company had fewer than 20 employees, and her plan wasn't considered creditable by Medicare. When she finally applied for Medicare, she was told she'd have to pay a 20% penalty for the rest of her life, plus, she had a 4-month gap in coverage before Medicare kicked in. Medicare Enrollment Guide for Seniors. Now that you understand the different enrollment periods and the penalties involved, let's focus on how to avoid those mistakes and enroll the right way. Here are 3 simple steps to help you enroll in Medicare without delays or penalties. Step 1. Know your eligibility. You're eligible for Medicare at age 65 if you're a U.S. citizen or a legal permanent resident who has lived in the country for at least 5 consecutive years. If you or your spouse worked and paid Medicare taxes for at least 10 years, you likely qualify for premium-free Part A. But Part B is optional, and it's where most people make mistakes. Even if you don't need medical services right now, failing to enroll in Part B at the right time can cost you later. Step 2. Understand your situation. Are you already receiving Social Security? Then Medicare Part A and B will likely be enrolled for you automatically. But if you're not, for example, if you plan to delay Social Security to receive higher benefits, you must take action and enroll yourself. Are you still working and covered under an employer's health plan? If so, is that plan from a company with 20 or more employees? If yes, you may delay Part B without penalty, but only if your insurance qualifies as creditable coverage. If you're unsure, contact your HR department or check directly with Medicare. Don't assume, verify. Step 3. Mark your calendar and enroll on time. The safest approach is to enroll during your initial enrollment period, the 7-month window around your 65th birthday. Apply early, especially during the first 3 months, to avoid coverage gaps. If you need to apply manually, visit www.ssa.gov or your local Social Security office. The process can take time, so don't wait until the last minute. Medicare Enrollment Checklist. Will you turn 65 within the next 12 months? Are you receiving Social Security benefits yet? If not, have you marked your initial enrollment period? Are you still working? If so, does your employer have 20 or more employees? Have you confirmed whether your current health plan is considered creditable coverage? Are you planning to delay Part B? If so, do you understand the risks and deadlines? Have you checked your expected Part B premium based on your income? Do you need additional coverage like Part D, for prescription drugs, or Medigap? If you couldn't confidently say yes to all of these questions, now is the time to look deeper into your situation. Common questions and answers. Question: Can I just wait until I need Medicare? A. No. Waiting can cost you in 2 ways: lack of coverage when you need it and lifetime penalties on your premiums. It's better to enroll on time, even if you're healthy now. Question: What if I'm still working and have great insurance through my employer? A. You may be able to delay Medicare without penalty, but only if your plan is creditable. Check with your benefits administrator or Medicare directly. Question: What if I live abroad? A. If you live outside the U.S. and are not currently using American healthcare, you can delay enrollment, but once you return, you must act quickly to avoid gaps and penalties. Question: Is Part B optional? A. Technically yes, but skipping it at the wrong time leads to permanent penalties. You should only delay if you're actively working and have verified creditable coverage. Question: What if I have VA or TRICARE benefits? A. Those programs are separate from Medicare. You may still be required to enroll in Part B to avoid losing certain VA or military health benefits. Now let's take this a step further. Just signing up for Medicare Part A and B is not the full story. Many retirees don't realize that Medicare doesn't cover everything. Hospital stays and doctor visits might be partially covered, but what about prescription drugs, or the 20% coinsurance left over from Part B? That's where Part D and Medigap come in. Let's take an example. A 67-year-old woman named Helen signed up for Part A and B, but skipped Part D because she was healthy and didn't need any medications. 2 years later, she was diagnosed with a chronic condition that required daily prescriptions. Now, not only did she face hundreds of dollars in monthly drug costs, but she was also hit with a late enrollment penalty, added to her Part D premium every month for the rest of her life. That penalty? It never goes away. And then there's John, who didn't enroll in a Medigap policy within his 6-month window after signing up for Part B. By the time he needed extra coverage for a surgery, he was denied Medigap due to his pre-existing condition. Timing matters. Even more than you think. Here's something else most people don't know. Your Medicare Part B premium is income-based. In 2025, most people pay around $175 per month. But if your income was over $103,000, for individuals, or $206,000, for couples, your Part B premium could jump to $245, $349, or even more per month. This is called IRMAA, the Income-Related Monthly Adjustment Amount, and the government looks at your tax returns from 2 years ago. So, if you had a high income at age 63, it affects your premiums at age 65. There are ways to appeal IRMAA, for example, if you've retired or your income has dropped due to life changes, but you have to submit the right form and documentation in time. So again, timing and paperwork, they matter more than ever. Let's go back to the big picture. The most common regret people express about Medicare isn't, "I paid too much." It's, "I didn't know what I didn't know." They missed a deadline. They assumed coverage would start automatically. They relied on a friend's advice instead of checking official sources. And by the time they realized it, it was too late to undo the penalties, or to buy the plan they actually needed. You don't have to be one of those people. If you're approaching age 65, or your parents are, take action now. Have a conversation with your family. Mark your calendar. Make a checklist. Don't just hope it works out. Help your loved ones navigate this maze. Because once they're in, there's no easy reset button. Final reminder, Medicare isn't just paperwork. It's peace of mind in your later years. And the best time to get that peace of mind is before the crisis comes. So don't delay. Prepare today. Disclaimer, for video ending or closing voiceover, this video is for general informational purposes only. Medicare rules may vary based on your personal situation and state of residence. Please consult with a Medicare professional, the Social Security Administration, or an authorized advisor to receive guidance tailored to your case.